These people are still coming in. So forgive me about past to time to time. If you're just jumping in, please introduce yourself and your affiliation. As we're going through the presentations, go ahead and keep your noise muted just to prevent that background noise from coming in. But please feel free to put questions as we're going, particularly if you think you're going to forget them. We usually will go about 20 minutes per speaker. Sometimes we'll take a question or two in between, but for the most part, we'll save the bulk of the questions towards the back part of the 2-hour forum today. That way we'll be able to work through those questions, but also then address other hot topic issues. We do have a few announcements, but we will save that until after the speakers as well. I don't know, Marcella, if you've been able to, it's still not presenting yet. There we go. Okay, so you can go ahead and move forward on that. For those of you that might be new to the forum, I think I counted, this is the 9th one that we had. We started in 2022, not long after the pandemic started to shift, but many of us were already working and collaborating together prior to that. In fact, a protocol paper that we can talk about towards the end, if you're not familiar with it, was published before that as well. And several of us were really coming together and trying to figure out how to have conversations around this. And so this forum really coalesced and began sort of forming, where we were bringing in a couple of researchers every forum. It happens about twice a year. Now I think we're in like the summer winter kind of scheduling, and it's been really fun to get really insight into what people are doing, to keep up with some of the more current interesting ways people are using the Veggie Meter, and honestly to have a community to talk to each other when we run into challenges or issues, or you might be new to the device and just have all these questions about what you're supposed to do with it and how you're supposed to use it. That's really what this group is hopefully helping others do. If nothing else, serving as a platform where we can put questions out there and see where we can get more resources. So as you can see, basically we're here for hopefully sharing resources, sharing publications, sharing networking opportunities. And next slide. And so today, as I kind of reviewed a second ago, usually how these go is we'll have a couple speakers that will talk for about the first half, and then the second half we typically reserve for lots of discussion. And believe it or not, we usually go all the way up to the end. If you have to leave early, it's no worries. We do generally record the presentation portion of it. Sometimes we record the discussion. If there's any sensitive things that come up, of course, we can edit that out, but usually we're fine on that end. And then we'll post that with everyone's permission to make it available to others that are really interested in seeing, particularly those presentations with the new research that's coming out. So that's how we'll go today. And so I'm excited to introduce the first speaker, Dr. Carmen Byker Shanks. She is a public health nutrition leader advancing healthy food systems and dietary quality in the US and globally. As the Director of Scientific Strategy at the Center for Nutrition and Health Impact, she guides research initiatives and long-term planning, building on her prior role as a principal research and scientist. And from 2011 to 2021, she was a tenured professor at Montana State University of Food and Nutrition and Sustainable Food Systems. And so across her work, she focuses on how evaluation can illuminate the best approaches to public health nutrition, driving better practice and policy translation. Her Veggie Meter research specifically exemplifies this, examining how researchers can deploy the tool in community spaces and advance evidence-based practice and pinpoint areas needing strengthening, which is perfect for this group. Dr. Byker Shanks holds a PhD in nutrition from Virginia Tech. She's also a registered dietitian, and she lives in Bozeman, Montana with her family. And so we welcome Dr. Byker Shanks, and I will say she's going to present one of her papers, which we can go back to that here in a minute if you wanted to download the more recent paper that was published that she's going to talk about. And I'm going to share your slides now so we can go ahead and get started.
Wonderful. Thanks, everyone. I am on video now just to say hello, but I'm actually going to go off video because of my internet connectivity issues. So I just wanted everyone to see that I'm a real face behind the screen. But I'm really excited to be here today. This is my first time at the Veggie Meter Forum and curious about your questions and your projects as well. So thanks for this invitation to present and for organizing the forum. So I am going to share my findings from a mixed method study that I just published with several co-authors, one of which is on the call today, Stephanie Jolcott-Pitts. And we recently published it in JAND. The paper is called Application and Adaptation of a Tool for Measuring Skin Carotenoids in Community-Based Settings. It really looks at how community-based teams are actually using the Veggie Meter, what they follow, what they adapt, and why. And my hope is that you'll find some of your own practice in the findings of this work, and that the findings generate a really good discussion in the forum today and give you some useful language and evidence to document what you're doing. Next slide. So I work at the Center for Nutrition and Health Impact, so I just wanted to give a brief word about us. We're a national nonprofit research institute and staff of over 60 folks working across many states across the US. So that's why I'm in Bozeman, Montana. Our work focuses broadly across public health nutrition. And a big part of what we do that's relevant to today is building measurement strategies to assess the impact of health programs. And that's really where this Veggie Meter work evolved. We partner with nonprofits, other researchers, academia, government, private foundations to a lot of times build measurement strategies. So through the center, I work as co-project director of the GusNIP NTAE Center, which specifically serves GusNIP grantees. Those are nutrition incentive and produce prescription sites running across the country to provide training, technical assistance, and evaluation support. And I mention that because the NTAE center work that I do is central to how this study came about, which I'll talk about on the next slide. So I want to talk first about the project's origins because the study didn't really start with a literature review. It started really in the field. And as I mentioned, as the GusNIP Evaluation Center, we were supporting grantees who were using the Veggie Meter to evaluate impacts around fruit and vegetable intake in their work. So they were doing this in community settings because GusNIP programs, so produce prescriptions and nutrition incentives, operate in community settings like farmers markets, corner stores, schools, health fairs. And we kept hearing the same questions over and over across projects. And those kinds of questions weren't necessarily answered in any protocol. We couldn't look them up online. And we're the evaluation center, so we like to help the projects we work with really figure out a good evaluation plan. So some of those questions were like, do other teams wash hands or use alcohol wipes in the field when there's no sink? What's the best approach? Which finger, when the ring finger has a scar or staining? Are single scan or triplicate scans better? And does it actually matter for research design? How do you handle children with fingers too small for the lens? What do you do when calibration curve looks nothing like the manual? So all these types of questions came up and more. So my co-authors, Betty Izumi, Jenna Eastman, Margot Hartenfield, Stephanie Jolcott-Pitts, they were seeing the patterns outside of the GusNIP program as well. So we partnered together to do this work and thought that, the Veggie Meter is a tool that has protocols out there, but there are adaptations happening in real time that are inconsistently documented and rarely published. And so the co-authorship team on this paper is a reflection of working together to meet active field research around the Veggie Meter. So the study emerged because we wanted to really understand what's happening in the field and how to get a better handle of what happens with adaptations and so that's really the origin of why we did this work. Next slide. So our formal research question, how has the Veggie Meter been applied and adapted in community-based settings in relation to recommended practices? Specifically, the recommended practices that we drew on were from Radke's paper in 2021, the recommendations for the use of Veggie Meter for research settings. Next slide. For the study that we did, we used a convergent parallel mixed methods design, and essentially that means we collected quantitative survey data and qualitative interview data simultaneously. And really what's important to that design is that we analyzed each of them independently and then integrated the findings together for interpretation. And I'll walk you through how we did that and what we found. Next slide. We recruited through a couple of different channels with our survey and interviews. We directly contacted GusNet projects that we knew were working on the Veggie Meter. We used the Veggie Meter listserv, and we used the NOPRIN listserv, which has roughly 3,000 members doing public health nutrition research. Eligibility to be involved was pretty straightforward, English speaking, 18 and older, and having actual experience collecting Veggie Meter data in community-based settings. And we had IRB approval for this, and participants received a small gift card for their participation. So we'll first start with the survey. This was the quantitative piece of our work. So it was a online survey administered through Qualtrics, and participants who were eligible completed the survey, which was adapted from the current practices, Radke's current practices survey, and we only made minor wording changes to reflect community-based context when it made sense for the question. You'll see the comparison table shortly. So 14 individuals completed the survey, each representing a different Veggie Meter project, and their roles included project directors and data collectors, and the project directors had also collected data. Experience ranged from teams that had used the device with fewer than 60 participants to teams that had used it with more than 200. Next slide. The qualitative piece was the other component that we used to understand adaptations in the field. So these were interviews. They were conducted in 2023 from March to July over Zoom. And they were recorded and transcribed, and then we used a thematic approach to analyze the data. We had 10 interviews, and we reached saturation at 10 interviews, and so we moved on to our overall analysis then. Our analysis included 16 codes and collapsed into 3 themes, so I'll really walk you through those 3 themes that were used when we integrated the survey results with the interview results. Next slide. So results were integrated from 14 distinct Veggie Meter projects and organized into 3 themes. So balancing protocol adherence with contextual adaptation in Veggie Meter use, implementation and operation of the Veggie Meter in community-based settings. And then the third one is strategies for maximizing participant engagement with the Veggie Meter. So I'm going to take each one in turn and talk about both the survey and the interview results and the specific adaptations. Next slide. So theme 1 really compared what Radke and colleagues recommended with what community-based teams actually did. So I took the paper and organized this a step further. to talk about alignment with the protocol recommendation. So on the first column, you can see the protocol element. The second one is the recommendation. The third column is the survey and the survey responses. And then the next column, because we're short on time, is the alignment column. And I thought it would be easier to talk through that with you. So where there was strong alignment with the recommended protocol was in calibration, the scan mode, so having triplicate or an average of 3 scans, and then lens cleaning using an optical cloth plus glass cleaning. Um, there was moderate alignment in hand preparation. And on the next slide, I'll talk about why these different alignments exist, but I'll quickly go through them now. So there was moderate alignment in hand preparation and hand and finger use. So hand and finger use is the non-dominant hand right finger. And then there was partial alignment in allowing the Veggie Meter to warm up. And then there was weak alignment in the environmental recording, so recording the temperatures and conditions in the environment where the Veggie Meter scans are happening. Next slide. So what was driving these adaptations was really what we found in our interview data. First, infrastructure and community-based settings. So an example here is no sink meant no hand washing. And one interview put it plainly, we would have them use hand sanitizer wipes, but that was a limitation because many times there wasn't a sink in the room. The practical limitation is that in community-based settings, sometimes a sink is not available, and that sites adapt by bringing wipes. There was the infrastructure in community-based settings a lot of times drove these types of adaptations. Participant fingers or factors, excuse me, drove adaptation. So in this example, finger staining was a real issue, particularly with children. One team described working in a community where children frequently had fingers stained with chili powder from snack foods, which skewed the reading. So that adaptation was to use a different finger and note it. So this quote says, we tend to prefer non-dominant border communities eat Takis. Children's fingers were stained with chili powder, and so they erred on the side of the non-dominant. Children's fingers were other examples existed, such as like children's fingers also sometimes were too small to cover the lens, and in some cases the thumb worked. In other cases, the data collection had to be they had to recruit a new participant or rescheduled to figure out what to do. Next, adaptation is time pressure in community-based settings, so really drove adaptations. So the 15-minute warm-up a lot of times got compressed when there was pressure to start. A lot of teams talked about, arriving early enough if possible, but sometimes it just was not possible to arrive early enough. And so that time pressure really drove a lot of adaptations. And then the research design, particularly around the scan mode. So the scan mode, lots of teams talked about deliberately choosing 3 individual single scans instead of the triplicate mode to maintain control. And that was a choice. And the teams talked about having to really state that in their methods to talk about that adaptation. Next slide, please. All right, so our next theme covers what it actually takes to deploy the Veggie Meter in community settings. We had 4 topics around what's super important to make the Veggie Meter happen. So training, the environment, data recording, and data considerations really came out of our interviews. So every for training, every interviewee used an operations manual. And beyond that, there were lots of best practices that teams had documented in an internal protocol. And they felt like that best practices document was important to have beyond their regular protocol to help make those adaptations in the community-based setting. And they also felt having an experienced data collector with them was extremely important, especially with like the time demands that a community-based setting and the number of participants that might be lined up would take to have someone to help do troubleshooting pretty quickly. Um, what most teams said they really wanted was a quick troubleshooting guide, an FAQ for frequent questions, a best practices summary to just be able to look up really quickly in a community setting. If you have materials like this, I was thinking this forum would be a good place to share them for people to use and adapt to their different settings. The next one was about the environment. So many projects collected their data indoors. Two also collected data outdoors because outdoors require shade and direct sunlight created measurement problems. A tent or equivalent structure was essential for outdoors, and storing the device in a climate-controlled location when not in use was something that many folks recommended as a requirement. The next one is data recording. So most teams recorded measurements on paper during data collection and then transferred it to software later, just because of the sketchiness that can be the internet in community-based settings. One used an online form, but also had backup in case the internet went down. And and so this was something that was mentioned across board. If you're going to use internet, bring paper and pencil, regardless of how confident you are in your digital system, because beyond the internet, computers freeze, screens lock, etc. And recording uh, things to record beyond just the measurement itself that teams felt were important or time, temperature, humidity, indoor, outdoor setup, calibration events and timing, and what device was being used. And folks felt that this contextual data really helped if the data seemed off later, it helped to really understand why. It was off and could drive some comparisons between like other times that data was collected. And then the last one is data consideration. So within participant variability was noted across multiple teams and multiple measurements. So using a single device across all participants in a study where possible was super important to the interviewees that we talked to. If sharing a device across teams, clarifying who has access to those devices in advance, what those devices are named, and how the results will be shared so that they're not confused between devices was very important. And it felt like to interviewees that that could become very confusing in a community-based setting, which is pretty fast-paced. So in addition, cost was noted by some interviewees around the Veggie Meter, and sharing instruments across projects was recommended, but also that with those recommendations were the same recommendations of like keep track of which one you're using and document all that. Next slide. Okay, so troubleshooting also came up in our our theme too, so I wanted to list it separately. It was an important consideration, and I would say a lot of the troubleshooting focused on calibration. That came up in every single interview. And when the calibration display didn't match expectations when like setting up the Veggie Meter in a community-based setting, we had lots of recommendations for what to do, and I just listed those there. Powering the device off, wiping the lens clean, waiting 5 minutes, restarting the device, running dark calibration first, then running white calibration, taking a reading on yourself to confirm, and using a different device if available were all of the troubleshooting recommendations. I will say there was a lot of time spent talking about that because I think it's a stressful situation in a community-based setting. Interviewees describe the Veggie Meter feeling like a black box when troubleshooting issues occurred. And when the curve looks wrong, it's hard to know what's happening inside. And manufacturer contact definitely helped, but reaching out mid-data collection from a community-based setting was not always ideal or even doable. So having a designated troubleshooting person and a pre-planned protocol felt pretty important. On the manufacturer responsiveness, 8 of 10 interviewees found longevity link very responsive. One team raised a concern about measurement differences by skin tone, and the manufacturer developed an index modification in response. I'm not sure if that was longevity link or not. What teams wanted more of was proactive technical upgrade communications, and a dedicated support contact that could be like more on demand. Next slide, please. All right, the last theme, um, just to describe before getting into the participant engagement piece, because theme 3 is about strategies for maximizing participant engagement with the Veggie Meter. Just to give you a sense, 6 of the 14 teams collected data on both children and adults. Populations of focus were frequently food insecure, low income, or had a really specific health diagnosis like type 2 diabetes. And so the participant engagement results, I want to tell you them with that context in mind. So with participants, what generated a lot of enthusiasm was the speed, simplicity, and the fact that it didn't hurt or didn't involve blood with the Veggie Meter. The device was often described as cool. One interviewee captured it well. They can't believe there's something that can actually do this. The next one is what generates apprehension. The most consistent concern in community-based settings was privacy. Participants worried the device would scan their fingerprint, collect DNA, or store personal data. 2 responses worked well to this, demonstrating the measurement on your own finger first to build some trust, and showing that the device isn't actually connected to the internet. One small but important language note from interviewees was to avoid the term finger scan, as it consistently triggered concern in ways that other framings didn't. For children, most assumed a poke was coming. This fear typically vanished the moment the measurement was completed, and the challenge is more getting them to that point, demonstrating first, framing it as a game, or being explicit that it doesn't hurt at all really helps. The next one is communicating results. So most teams shared results. The framing that worked, so they shared their results on site with participants. The framing that worked was focusing on within-person change over time, not a fixed score, avoiding labeling any results as good or bad, and framing higher scores as reflecting more fruit and vegetable intake. Some use the device's built-in color coding. Others use printed summary sheets with dietary guidance on the side, and that was well received, although mentioned as an intervention in itself. And for multilingual sites, it was very important to prepare translated scripts in advance, because so it's hard for one person to improvise on technical terminology in many languages in real time. And then the last one was multiple interviewees described participants as competitive with each other, both children and adults, with their scores. And this was genuinely motivating, but was also a threat to more research and controlled trials. If a design requires blinding participants to their scores, then the recommendation was to plan that really carefully, because it's actually difficult to shield people from seeing the screen and they're super interested. So on another note, I mentioned that there was in the paper that there was one study in Japan where the Veggie Meter was explicitly used as an intervention to improve dietary behavior in school students. And so this was sort of in comparison to the fact that, sharing the results with participants is definitely an intervention in itself, and there's precedence for this out there in the research for it being a behavior change technique. And so if there's a need to be blind about the results at all, that there has to be really careful planning in community settings, especially because people are excited about their scores and really want to compete with each other about who's doing better. Next slide. So just a couple of conclusions and reflections of my own. Adaptions are really the norm in community-based settings and not the exception. Every team we talked to deviated from at least one recommendation. That's really not a failure in protocol. It's just the reality of community-based research and evaluation. And I think one of the reasons why this forum exists. So context really drove those decisions, setting infrastructure, participants, research, etc. The question isn't whether you adapt, but really I think the importance around this is documenting those adaptations so that those adaptations can be compared across projects uh, and results. Documenting everything, I think, is something that we noticed was not done consistently in the field because the factors that are in the community-based settings can really drive can can really drive understanding of the data. And the next one is that the Veggie Meter may be an intervention, not just a measure. So the competitive nature of the Veggie Meter is something that's definitely worth thinking about in community-based settings, as whether or not you want the Veggie Meter to be part of your intervention or you want it to blind the results from participants. And then the last one is share what you learn. I think what our team learned in collecting this data is that adaptations are really important to this work, and I think this forum and this community are really a primary mechanism for really understanding what to do in real world settings. So it's very awesome that this exists, and your documented adaptations and contributions to the literature really advance understanding for everybody about what to do best in the field. Next slide. I'll put this PDF in the chat, but we created this checklist based on our work for for folks using the Veggie Meter in community-based settings. Just reminders of what's important to document in community-based settings to help advance the work for everyone. Next slide. So if you have any questions, I'll be here after the next speaker to answer them all. Also, I saw some things come through the chat, so I'll try and chat you back, and I'll also put that PDF in the notes. But I do want to acknowledge this was funded through our GUSNIP grant at the NTAE Center, and please reach out by email if you want to chat or collaborate. Thanks.
Thank you so much, Dr. Byker Shanks. Amazing work. It's really incredible to see all of the work for communities and working within the community space. And it is very different than a controlled research setting where you have labs and access to all of the things that I think we initially thought of back in, I think that was 2021. So with so fewer people using the device back then, the evolution is very exciting to see. So with that, we will go ahead and introduce our second speaker. If anyone has any questions, please feel free to drop those into the chat. We will facilitate the Q&A after the second presenter. So I think you should all be able to share our screen as Virginia introduces Dr. Pietro. Oh, you're muted, Virginia.
And Zoom is telling me to unmute as well. So I am going to introduce Dr. Kevin Pietro, and he is not the only speaker today, so forgive me for leaving off the other two, but Dr. Pietro, I'll let you introduce those two individuals before you get started. They're also listed there in the email, and I can put their names in the chat as well. But Dr. Pietro is a registered dietitian nutritionist, and he's worked extensively in the clinical and community settings as a board certified specialist in sports dietetics. And since entering academia in 2012, he's taught over 30 different courses at 4 different institutions. His research focuses on improving dietary quality, including exploring alternative proxies for dietary quality, including the Veggie Meter, and supporting health-related behavior change in fitness and wellness settings with a particular interest in scalable community-based approaches to delivering practical nutrition interventions. He's got 2 colleagues that he's going to introduce that's joining him today.
Thank you. Thank you very much. Thanks for this opportunity. We just have June Tenfelde's going to be joining me today. Kate was unfortunately couldn't make the presentation. So June and I are going to split this presentation essentially right down the middle. I'll go ahead and share my screen and we'll go ahead and get started. Okay, are we all looking at the slide?
Looks great.
Okay, great. Thank you very much. And thanks for allowing us to come present some of our findings from a pilot study that we launched this past fall. My name is Kevin Pietro. As the introduction was preceded, I joined Loyola in 2024, and so I'm a tenure track faculty member, but I'm also carrying the program director burden and torch. Which is, I think, part of the reason why we launched this type of study that really leverages what we have at the health science campus at Loyola, but then also builds this into the curriculum. So I'm joined by June Tenfelde, and June is an amazing research assistant where none of this could have been possible without June's guidance and support here. And so this project is really part of a larger vision, and so we're trying to as a program director, but tenure track faculty, trying to really marry my teaching and research, find those synergies, but then Loyola is committed to community engagement. And so as my research interests are really focused on health promotion, disease prevention, with this angle towards behavior change, the process, the social dynamics of behavior change, but really wanting to find ways to plug my grad students, so future dietitians, into the research process and get them thinking of how do we collect data systematically and then make nutrition education decisions based off of that. And so we're fortunate enough to have a Center for Fitness here at Loyola, and this is on the Health Sciences campus. This is a community fitness facility. The Health Science campus is a mixture between Loyola University, specifically the School of Medicine, School of Nursing, and the School of Health Sciences and Public Health, as well as the Medical Center, outpatient, inpatient, and a cancer center. There's more than 7,000 members at this health science, at this Center for Fitness, which is a mixture between the health science campus and local communities, and it's literally outside my window. And so it was almost too good to be true. It's right here, and they have no dietitian. And so from both a research standpoint as well as a program director standpoint, wanted to figure out ways in which we can get our students over there, and we come to find out they're incredibly motivated bunch of individuals who are beginning to make lots of health-related changes, primarily in the physical activity, but we're starting to see a gap in dietary quality. And so in the fall, as part of my research methods course, we rolled out a pilot study, cross-sectional pilot study, which we recruited 413 members in just 4 weeks. Due to the wonderful support of June and Kate, my lead research assistants, and the 14 other graduate students we had as part of this course. We then translated the results from that with the help of some biostatisticians, created a 7-part nutrition education series that we then went back to the Center for Fitness and delivered. And so the students built and delivered nutrition education talks, 45, 60 minutes as part of my nutrition education and counseling course in the spring. And so they were able to see this come full circle. And so this is a relationship we're very carefully nurturing and supporting. And we'll talk about how this kind of it's went really well this first year, but I see from a scholarship and a program direction standpoint, this kind of real world application outlet for us being really important. So there's a decision we made related to body composition that we'll talk about some of the push and pulls of research here. So for today, we're going to focus in on an aspect of our assessing dietary quality and chronic disease risk at the Center for Fitness, the pilot study, and we're going to focus in on our use of the Veggie Meter. And so with that, I'll turn it over to June.
Thank you, Kevin. So when I first started walking with Dr. Pietro, the first task I was given was to read every single Veggie Meter I could come across. And so it's part of the reason why I'm really excited to be here, recognizing a lot of names on the screen. But one of the first articles I came across was this recommendations article that Dr. Radke and her team published. And so they were aiming to survey researchers using the Veggie Meter to determine what their current practices were, and found that across the methodologies, there was no uniform process of collecting this information. And so that led them to create this standardized protocol to use the Veggie Meter to quantify skin carotenoids with the aim of increasing generalizability across studies and to create a skin carotenoid data repository. And so here are those recommendations. These were created based on the existing literature at the time, the input from Veggie Meter creators, and the results from the current practices survey regarding recommendations. However, these recommendations were not empirically validated, nor had been, which is then what we set out to do. So in an ideal world, we would have been able to explore and validate each component. We would have done all 10 fingers on every different scanning mode, indoor, outdoor, clean the fingers all a bunch of different ways. However, we were catching people as they were coming in and out of the gym. And no matter how good the smoothie we were offering was, they were not going to buy into a lengthy study. So we had to be a little more strategic. So with that, I went through all of the articles I read and pulled what fingers were being used most commonly. And from that, I found that over half of the studies were using the index finger, with the right index being the most common use. So we were able to narrow down our scope of which digits we wanted to investigate, which brings us to our research questions.
And so our primary research question on this aim of the larger pilot study was, how do skin carotenoid scores vary depending on finger selection and scanning modality? And so, as June mentioned, as we think about finger selection, we're primarily talking about the non-dominant ring and the right index, and then scanning modality is the average of 3 individual scans versus the triplicate. Now, because it was part of a larger pilot study, we did have hand grip strength. And so we were also curious how hand grip strength and dominance impacted skin carotenoid scores. We also have measures of excessive adiposity, smoking status, dietary quality, and dietary supplement use. And so from a methodology standpoint, we had research assistants. The Center for Fitness was incredibly gracious, gave us 2 tables right smack in the middle of the lobby for an entire month straight. And so we had in shifts of 2 or 3 research assistants with a lead research assistant at all times down there. And as June mentioned, as people walked in and out of the gym, we asked them, hey, do you want to participate in nutrition research? As you can imagine, as we're all researchers on this call, the idea of participating in nutrition research, you do tend to get a certain type of person who might be interested in nutrition research. And so there were a whole host of people that either turned their head away and kept walking, or said that, their dietary habits, we weren't interested in their dietary habits. I don't know what they thought we were after, but and so we tried to keep this, as we knew this was going to be challenging getting people in and out of the gym, right? And so there are certain methodological decisions we made, like this first pilot study did not do blood pressure, right? Because we don't know if we're getting someone that's coming out of the gym and their blood pressure might not be as a normal reading. And we also tried to keep this as brief as possible. And so we kept it down to a 30-minute total ask to minimize participant burden. So after the informed consent, the first 15 minutes was a nutrition, health, and fitness survey done in REDCap. Demographic information, health history, fitness center usage, Physical activity, we use the IPAC, which is International Physical Activity Questionnaire. We modified it similar to what's been done previously to add a muscle strengthening question. This allowed us to get at adherence of the physical activity guidelines. The muscle strengthening question looked very similar to the way in which the questions read for vigorous and moderate activity. We did dietary-related habit questions, so things like alcohol consumption and supplementation. And then we ended up using our approach towards diet to minimize participant burden, and also kind of from a pragmatic use of the students' time as part of the research methods course. We used a dietary screener. And so this was a total dietary screener using the WELL diet. And the WELL diet strongly correlates to the Alternative Healthy Eating Index, which was determined from the 125 block FFQ. And this came out of a group from Stanford, which now Sparkle is one of the faculty members in public health at Loyola. And so this is if you're unfamiliar with the WELL diet scoring tool, this is a 12-item total diet screener. And so you see the questions there related to vegetable intake, fruit, whole grain, sugar-sweetened beverage, sugar-sweetened baked goods, beans and lentils, nuts, seeds, nut butters, red and processed meat, fish, high sodium processed foods, fast food, and if they prepare their own meal. And so the nice thing is this is incredibly quick. This is kind of comprehensive if you think of the dietary areas this asks questions about. 12 questions. Each question is scored from 0 to 10. And so you see what a 0 looks like for each category. You see what a 10 looks like for each category. One of the really nice things about the WELL diet score, in addition to being incredibly quick to administer, is that it has a certain branch logic that's used in the way in which the options are displayed. And so participants never see more than 4 options at any given point. And so there's an initial question. So we'll just play with the first item. How often do you eat vegetables? Participants are then prompted with the 3 following options. None of these are scored. And so these lead to the kind of the nested scoring options that are underneath each of these. And so if someone selected less than once a week, they were prompted with, so when you say less than once a week, do you really mean never? 1 time in the past month, 2 to 3 times in the past month. And it's these that are actually scored. And so there's 10 total options. And so as you kind of go through the various frequencies every week, but not every day, results in these different intervals per week. And then every day, these intervals per day. And so you can get to see, this is of course more Veggie Meter than is diet quality. And so we'll just focus here on the top right quadrant. And so we became really fascinated with individuals who were scoring high in the categories of fruit and vegetable. And so when we looked at our data, have made a subscale score of fruit and vegetable intake. And so that would be out of 20. But really curious about the people who are getting 16 and above, which indicates that they're eating at least 1 serving of fruit and 1 serving of vegetable a day, or self-reporting 1 serving of fruit and 1 serving of vegetable a day. In addition to the 15-minute survey, we had 4 non-invasive clinical measures, and that took the other 15 minutes. All research assistants, as part of the course, were trained in a kind of a stepwise process. They went through a live demonstration for each of these 4 measures. Then they went through it as a participant or a mock participant. They watched a training video, and then they were tested, and they had to get 100% on their demonstrated test in order to pass, in order to go and collect data for real. They did not like me through the process, as you can imagine, but it was necessary. The first of the 4 was hand grip, and so we used the Jamar digital dynamometer. 3 measurements per hand. We alternated hands. They were seated for this, elbow at 90 degrees against their side, and a 3-second count using a squeeze, 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 stop to keep it consistent among hand grip attempts. For waist circumference, we use a Gulick 2. One of the nice things about this is at the very tip of it, it has a tension meter. And so this allows us to wrap the tape measure around and also ensure that we're pulling on a very consistent amount of tension each measure. We took 2 measurements. If they were different by more than a centimeter, we took a third. And then what was reported was the average of the 2 closest, the 2 within 1 centimeter of each other. If a participant indicated that or reported that they were pregnant or recently postpartum, we were skipping this step. And here becomes part of the push and pull of our newfound relationship with the Center for Fitness. For body composition, we use the Body Script Ascend. This is a near-infrared technology that estimates body composition. The Center for Fitness, when we were rolling out that we were going to do this study, they were incredibly excited for us to use their tool that is in the fitness center. And so, trying to be good stewards of this evolving relationship, we agreed. We do have a validation study slated for early fall because we do have a DEXA that's in a different building. But in an effort to kind of recognize this relationship and also keep participant burden low, I think one of the benefits is that unlike something like BIA, which is highly fluctuates due to hydration, this doesn't. And so we were still able to get people in and out of the gym. It didn't really matter which direction they were going. And then, of course, we used everyone's favorite Veggie Meter for our skin carotenoid scores. And so June will take us and talk through a little bit more about our methodology, about using the Veggie Meter in a moment. After all four of these, so we hand wrote all of these on a participant data sheet. June entered all of the results into REDCap. Our other lead assistant, research assistant Kate, re-entered all of these, and then discrepancies were identified by either me or June to ensure that nothing got lost in translation from the physical sheet in order to into REDCap. So June will walk through our painstakingly detailed approach to using the Veggie Meter.
So, as this study was largely inspired by the recommendations article, it only made sense that we were as meticulous as possible with regards to our own Veggie Meter methodology. So, we had participants wash their hands with both soap and water, and then wipe their digits with the alcohol prep pad as well to ensure there's as little contamination as possible. We cleaned the Veggie Meter lens with an optical cloth prior to each participant, and the machine was calibrated every 1 to 2 hours with the aim of being as close to that 1 hour as possible. And we kept a very detailed log with each calibration. And so we recorded the time, the ranges, and the environmental conditions. I will note that all of our collections were done indoors, but we still recorded the weather each day. May have been a little bit overboard, but we wanted to make sure we captured anything that could have impacted the Veggie Meter readings. And so you can see our setup here. We are right outside the cycling studio. And then in terms of Veggie Meter scans that we collected, we performed 3 single scans on both the right index and non-dominant ring, and then 1 triplicate scan on each of the digits as well. And then for our analysis, we were fortunate enough to work with a pair of statisticians from the biostats core at Loyola. So with their help, we examined the descriptive statistics using univariate analysis for key participant characteristics. One-sided paired t-test was used to compare Veggie Meter scores across the 2 digits and scanning modes. We assessed the amount of variation between the single scans we collected using the Mann-Whitney U-test to compare that variation within the coefficients of variance. And then univariable linear regression was used to estimate the influence of different participant characteristics on the non-dominant ring triplicate score. And we were particularly interested in the well diet scores, hand grip, body composition, supplement usage, gender, and age.
Okay, and so we were able to recruit, as I mentioned, 413 people in an effort to use a complete data set that knocked us down 20 participants. And so it left our final sample with 393. Average age, 52 years, predominantly or majority white female, and the dominant hand was right, about 84% of our sample. From a health status standpoint, the mean BMI was 27.7. Waist circumference, so this is the number of people that had a waist circumference beyond the recommended cut points. And so this is for women greater than 88 centimeters, for men greater than 102 centimeters. A very, very small percentage of our population currently was using tobacco or nicotine. And from a chronic disease standpoint, we had about 61% had at least one or more chronic condition, with hypertension, dyslipidemia, and osteoarthritis leading the way. From a diet standpoint, our well diet mean was about 71.9. And so this is out of 120. The subscale of fruit and vegetable intake, so this is out of 20, was 13.4. And dietary supplement, we almost had 90% of our sample taking at least one or more supplements. And so I think this, there's this aspect of attempting to make health-related changes, whatever that might be. And I think there's an interesting level of maybe an overproportion of misinformation that I think exists within fitness centers. But there's also that competitiveness that Carmen was talking about in terms of Veggie Meter scores, which was fun.
We'll start by answering our first research question. How do skin carotenoid scores vary depending on finger selection? So this is looking at that non-dominant ring and right index. So here we have our histogram with skin carotenoid scores on the x-axis and density on the y. And this first graph is going to compare the non-dominant ring and right index 3 single scores averaged, with the non-dominant ring being in purple and the right index is in green. And so you can see here that the non-dominant ring average score for those 3 single scans averaged was 292.5, and the right index average score was 314.6. And so this difference of 22.1 points we found to be statistically significant. So now we can compare the non-dominant ring triplicate and right index triplicate scores. Once again, we see a statistically significant difference in these mean scores. So going back to the recommendations article, this strengthens the recommendation of using the non-dominant ring when using the Veggie Meter, as it's the more conservative measurement. And if you're going for a proxy of fruit and vegetable intake, it's better to underestimate than to overestimate. And so to that second half of that research question, how does skin carotenoid scores vary depending on scanning modality? We can compare the average of 3 individual scans and the triplicate mode. And so here you can see we have a difference between these two mean scores of about 6.7, which while it is statistically significant, this change may not be clinically significant. And so looking at a similar comparison between the right index triplicate and right index single average, here we see no significant difference in these scores. So as a takeaway, if you are interested in seeing the ranges in scores that are being averaged by the machine, or like was mentioned by Dr. Byker Shanks, if you want to have more control when taking those 3 single scans, these 3 single scans may be collected and averaged. You won't see a large change between that measurement type and a triplicate score. And this is consistent with what is stated in the recommendations article. And so the crux of the argument in the recommendations article really is about whether a single scan is sufficient or if a triplicate scan is necessary here. And the recommendations article offers the triplicate scan as the best practice to account for potential tissue irregularities. And so here we compared the first single scan we collected for the non-dominant ring with that triplicate scan. And so our first single measurement scan average was 290.8. The non-dominant ring was 285.8. So once again, this difference is statistically significant. However, it's a difference of 5 points, which once again is unlikely to be clinically significant. And then, out of greater curiosity for how these scores are being collected, we tested the variation that is within the 3 single measurements that we collected. And so with a coefficient of variance of about 6 to 7% for both and no significant difference, this indicates that the Veggie Meter is a consistent measurement and that either the right index or non-dominant ring, if you're looking at its consistency, it is a reliable estimate of the Veggie Meter score. And so given that the Veggie Meter is a consistent and reliable measure, and the difference in the non-dominant ring triplicate and single scan is minimal and potentially clinically negligible, this supports that the single scanning mode can be used if necessary. However, as some amount of variation does exist, the triplicate scan mode should be used whenever possible to minimize the impact of any tissue irregularities.
And so with that, we decided to move forward with the help of our biostatisticians, primarily focusing on the non-dominant ring triplicate as the score in which we're going to move to examine various associations. And if you look at hand grip strength, we did see a statistically significant association for every 1 kilogram increase in hand grip strength for both right and left. Scores, the non-dominant ring triplicate score increased by approximately 0.7 points. And so a really small increase. I think we set out with the hopes, I think, of using hand grip as maybe a stand-in or some type of marker so we can maybe see how or in what ways increased vascularity or musculature or a callousness from being incredibly physically active maybe impedes this. I think in our sample, The physical activity habits seem to be aligned with maybe a greater health, being well nourished. And so I don't know if the hand grip strength can be that what we were hoping it to be, to maybe see if that was impeding the Veggie Meter results in any way. From a body composition standpoint, we did see strong associations for every 1% increase in percent body fat. We saw scores decrease by approximately 2.2 points. And for every 1 centimeter increase in waist circumference, scores decreased by approximately 1.5 points. No significant associations between gender or age in terms of the non-dominant ring triplicate score. From a dietary supplements standpoint, we did see that among participants who take a multivitamin, self-report a multivitamin intake, their scores increased by 16 points. For those taking creatine, we see that increase nearly 40 points, so the 38.7. I think this is kind of getting at that same phenomenon. We have a population who thinks that they're in many ways doing lots in what they feel is all that they can in order to improve their health. And I think that means a lot of things for a lot of people. And so I think what we're having here is not making any mechanistic claims, of course, about creatine and skin carotenoids, but more so that there's health-minded people out there trying to approach health in different ways. And then any supplement, we see association scores increased by 27 points. Thankfully, I think we would question the whole thing if we didn't see this being a strong association with fruit and vegetable scores, and so we do. For every 1 point increase in our fruit and vegetable subscale score of the WELL diet, we see non-dominant ring triplicate scores increase by 4.5 points. While we were comforted by that, I think we were more excited that total dietary quality also had a strong association with non-dominant ring triplicate score. And I think this was one that really got us thinking of, wouldn't this be great if the Veggie Meter can be not only a proxy for fruit and vegetable intake, but also a proxy for total dietary quality. This sent us down a whole rabbit hole of, beginning to question if we had the data, if we can look at it from a different vantage point, and began to explore Veggie Meter scores of those who had 18, 19, and 20 out of 20 for the fruit and vegetable subscale score to see if we can begin to answer the question that we got about 400 times from people.
So participants would stick their finger in the Veggie Meter, they'd watch the bar move, and immediately upon seeing their score, they'd ask, "Is that good?" Fortunately, we anticipated this question. It was part of the training that our research assistants received. We'd mentioned that a higher score indicated greater fruit and vegetable consumption and would draw their attention to the comparison with the general population. But this led us to wonder if there was a way we could work backwards with the WELL diet to come up with a goal score, or a clinical cut point we could offer the participants. And so one caveat, the following slides are really just a first attempt by our statisticians to get at this idea of a clinical cut point. And our aim in sharing this data is more to open a discussion about how one might devise a clinical cut point, or how we should approach answering this question. And so our first attempt was to look at how the non-dominant ring triplicate scores compared to the fruit and vegetable subscore on our WELL diet. And we focused on participants who self-reported meeting the daily recommendations of about 5 servings of fruits and vegetables per day, which corresponded to a score of 18 or higher. And so, as you can see, there is a wide range in skin carotenoid scores amongst those who scored highly on the WELL diet. This is likely due to the use of a self-reported fruit and vegetable intake. So maybe some were overestimating or underestimating their fruit and vegetable consumption. So our first attempt of visually identifying a cut point did not work. So we had to try something else. Our next attempt was to use separate logistic regression models where we estimated Veggie Meter scores associated with pre-specified predicted probabilities. So we looked at 60 through 90%. So the probability of meeting or exceeding those fruit and vegetable thresholds. And we looked at scoring greater than or equal to 11, 14, and 16. And predicted probability curves were generated to visually observe how changes in fruit and vegetable score cut points for each fruit and vegetable threshold. So once again, this was a first attempt of generating a cut point to help answer this question of, is my score good? Which was meant to generate this discussion, which segues nicely to our discussion section. So I want to start by highlighting some of the strengths and limitations of this study. So for our strengths, This is a novel population. During our literature search, we were unable to find studies that utilize the Veggie Meter in a fitness center setting or in physically active populations. We also had a relatively large sample size with almost 400 participants with 8 skin carotenoid scans each. So we're adding a lot to this grander biorepository of skin carotenoid scores. And then not only did we implement rigorous methodology based on expert recommendations, we were also able to substantiate the expert opinion with the results from our study. Then on to our limitations. This is a cross-sectional study, so no causal relationships can be drawn, particularly when it comes to the association we explored using our univariate regression models. We used a self-reported dietary intake method, so that's going to come with its own set of flaws. We had most certainly a selection bias, so our findings may not be generalizable to the greater population of fitness center members. And as Kevin mentioned, we used a convenient approach to body composition. The body script percent is not a validated measure yet, hopefully. So we used it, however, as a tool as it was readily available at the fitness center.
And so some of our key takeaways from this pilot study that we're going to continue to build upon. I think we showed that this was in this study, the Veggie Meter was a reliable measure of skin carotenoid scores and can be used in the fitness center settings. High body fat percent, especially in the context of greater central adiposity, is associated with decreased Veggie Meter scores. And so I think to the body composition point, I think if we didn't have waist circumference also pointing in the same direction, I think we'd be a little bit more skeptical. But since waist circumference has a strong association, we're a little bit more confident. The non-dominant ring triplicate measure is the most conservative measure and should be used whenever possible. Hand grip strength and dominance in a physically active sample does not appear to impede Veggie Meter scores. We noted that we had a predominantly right-handed dominant group. And the mean score was higher in everyone's right index. And so I think we're trying to work towards thinking through how to answer that really pragmatic question of what score is a good score. And so I think that's some of the things that we are looking forward to next. Thank you very much for the opportunity. Here's some of the wonderful research assistants that helped to make all this possible.
Amazing. Thank you so much for sharing. It is validating that our methodology remains after 5 years. So very, very happy to hear that. Some of the recommendations were based off of literature from many, many years before about callousing and kind of the impact of the fingerprint and what it can do to light refraction, but really wasn't within the context of the Veggie Meter. So yeah, really, really exciting to hear your results. So we definitely have a lot of questions that came through in the chat for both of our presenters. Carmen, I think you said you have to hop off a little bit early, so I want to make sure that we can tackle some of your questions first. So I know, Alicia, there was some back and forth on your message, but maybe to think about some of the kind of outlier questions that have been brought up about what to do when scores are relatively high. And then I think in some cases, I think this was a previous conversation maybe a couple years ago, but some scores have been so low that they haven't even been able to be detected by the device and kind of what to do in that setting. So Kathy, Alicia, if either of you would like to speak on what you've been doing, and then Carmen, maybe we can hear if that was ever a point of discussion when thinking about this in the community setting.
Yeah, I brought that question up. Thank you. And in June, you kind of brought it home with you when saying, is that score good? And I think I brought that up because in the community setting, there is that like conversation that happens. Everybody says, what'd you get? What'd you get? What was your score? And we happened to be at a high school with students that were all like 16 years old. And this one student, she kept getting in the 700s. And so then they all got talking and it like kind of spun out of control, you know what I mean? Where the students just kept talking. So what our plan is for her is we're going to do a follow-up survey with her. We're going to get approval to do that kind of like you did at your fitness center. But yeah, I think it's like because it catches you by surprise. So it's almost like having the company line ready and prepared was kind of what and I agree with you, Marcella, that we've had the low ones as well, like 14 and you're like, really? Is this true? So thank you for your responses, everyone.
Yeah, Carmen, did that come up? I see you unmuted.
Hmm. Yeah, a little bit. I mean, people, I think, were more looking for answers about what to do. And so I think developing some sort of protocol ideas would be a really helpful next step for this group. Um, at, because I think at the stage that the field is at right now, based just on the folks that we talked to, their response was to document it and but they but that they didn't have a lot of ideas for next steps. So I like the idea that Kathy shared with the group.
Yeah, kind of doing like a retrospective follow-up, whether it's through a dietary intake survey or other measures.
Yeah, and I think Alicia as well, put, talking to the participant to get a little bit of a better context about what they're eating or if it could be finger staining. I think that that's pretty important too, but should be in the protocol in advance so that someone collecting data would know like exactly what to do and say in those situations.
Yeah. Alicia, did you have anything to add?
Yeah, we do a lot of work in school, so working with kids, this is super common. Like you were mentioning of, oh, one kid gets a super high score, now what? Or another kid gets a 14 or a 35, but they say, I eat my fruits and vegetables all the time, which they might. Um, so we've kind of come up with some standard language that as we're measuring each participant, I train our data collectors to just talk to them about how there are different factors that influence what your score is. It can be how much time you're outside in the sun and what your genetics look like, whether you can absorb these really well or your body breaks them down really fast. And depending on the age range, we kind of adjust that a little bit. But then it becomes like it starts to make more sense why we're saying what we want to know is what's your score today and what's your score again in the future. We're not comparing any two of you to each other directly. Um, so if we're doing something with a school, I'll often work it out with the teachers in advance so that we won't give the kids their baseline scores. What we'll do is we'll provide the classroom with their data set of pre and post. So then you're not like naming individual people who are really high or really low, but you're looking at what does this overall data look like? And then they can have the bigger, broader conversations about like providing them some information about these are the kinds of things that might make your score go up or that might make your score go down.
That's awesome. How do you, when you are doing that and kind of blinding the participants to their score? I know it was mentioned that it can be kind of challenging to not have them see it. Do
Mhm.
you have a strategy that has worked well for you for?
We set up the data collection in a very specific way if we have to blind the participants. So we make sure that the Veggie meter's on one side of a table and the computer's on the other side facing completely away from the participant. They still will often ask. And at that point, if we're blinding them, we'll say, oh, well, when we come back, we'll provide these to you, or like we'll do something like that. And then I just run it through, I do a brief analysis and pre-print it onto all of our documentation so that when we come back the second time, if we're looking at pre-post, that I can actually tell them, okay, the first time around, this was your average, and here's where you're at right now, so that they're still getting some of that.
Awesome. That's a really fantastic idea. Thanks for sharing. A lot of really good questions coming in the chat, Carmen. I had one that you mentioned about the melanin index, and I was curious what does that look like? Is it a numerical value? How was that interpreted? Because I think all of us with the device, how we have leveraged across diverse populations and different skin tones. Stephanie has done a ton of work to look at the validity across racial and ethnic groups, and so I wasn't sure what that value looked like that you were mentioning about the melanin index, and if anyone else has used that.
Yeah, we didn't get a whole lot of information from that individual interviewee, but we can definitely follow up and try and get more because it piqued my interest as well that was even a alternative strategy.
Yeah. As someone who has received a lot of feedback from grant review, it is one of the things that comes up again and again and
Hmm.
again. Uh,
Yeah.
and so, even though Stephanie's done so much work and there's, a pretty substantial data to support the use, I still think it's a question that comes up from people who are not well versed in the field, or maybe are well
Yeah.
versed but still have their questions too.
Yeah, I'll try and follow up with that participant and if we can get any additional information, can share it with you.
Yeah, that would be great. A couple questions in the chat. So there has been discussion around, obviously the triplicate mode on the Veggie Meter gives you a single output. So it doesn't give you the breakdown of each individual score across three measurements. And so one of the questions is recording those three individual scores still considered a triplicate? I would argue, yes, that is still a triplicate, and in fact, could be even more robust data because you will have a standard deviation for each one of those measurements. Of course, that does require then collecting the data, kind of having a lull in between, and can take a little bit longer. So I think the triplicate mode, speeds things up, and within the context of a community setting, is the preferred modality. But I believe somebody presented something.
Alicia, I was just going to ask
Oh,
if you
Alicia.
could speak to that because you had a really interesting presentation about that topic some forum ago.
Yeah. So we're working on publishing some data where we were doing comparisons of what if we take the first 3 scans versus 4 scans versus drop out an outlier versus like a whole bunch of things. Um, and after having like measured 500 participants for that study, I won't go back to do the 3 automatic scans. I want to know when I have an outlier, because sometimes you showed the coefficient of variance for your data. We had some people in our study where the coefficient of variance was upwards of 0.3. So you were talking on the order of like 0.06, I think, 0.065, 0.063. Um, but a 0.3 is 5 times more than that. Like I want to know if my variation is that high so that I can do another scan and drop an outlier. But then again, you have to put it into your protocol and figure out how to do all of that stuff.
Yeah, thanks for sharing. And I think with your findings, you found the average of 2 was actually more reliable than the average of 3. Was that
It
correct?
overall.
Overall.
Yeah,
Yeah.
yeah. So if we only had 3 scans, if I dropped the one outlier out of the three, it's still the if I compared that to like scanning them 6 times or 10 times, the average of 2 scans was more similar to the average of 10 scans than the average of 3 scans was, which is weird, but
Yeah.
whatever.
Yeah, thanks for sharing. Um, Additional questions in the chat. I think this is Adam Pape. There's like a very big discussion around this. I think a while back, a paper came out that kind of made some generalizations without really concrete data to support exactly this point. So again, thinking about like what to tell participants, especially in a cross-sectional study where we only have a single numerical output, is the score good? And so I think, there's a discussion around what that means and what that should consider. And so thinking about is there a recommended value at this point in time? I think going off of Kevin and June's point, no, there isn't kind of a one size fits all number that we should say everybody should be at this point to be meeting dietary recommendations. And I think that is one of the ultimate goals of this collaborative is to have enough data where we can start to think about how to project some of those values. And I think it's going to take a lot of us working together in order to do that. There probably should be a different number for kids and adults. I think we've consistently across the board have seen lower scores in children than adults. I think we know that within the field. But in terms of a specific number and what that corresponds to for number of servings, I think we don't quite have that yet. Virginia, I don't know if you have anything to add there since most of your work has been in the preschool younger populations.
No, just to confirm that. I will say there's one paper out there, and I cannot remember off the top of my head where it was, and I don't know if Sima's on the call or not, that did try to make a statement about that, but we could not track down where it was based on. So if you do see something published that says like, if it's less than 200, you should be throwing it out, and it was specific to children, we've not been able to track where they got that number from or what it's based on. So, and our major concern was the majority of our kids come up less than 200. So we would be throwing everybody out if that happened.
And yeah, just anecdotally, I'm working right now in a population of head and neck cancer survivors, and dietary intake is really challenging. And every single one of the participants has been under 200. So I think, going off of a lot of people here have looked at the Veggie Meter as it compares to different measures of diet. And, again, anecdotally, I think those low scores, it doesn't mean to just toss them out. I think there is a lot of validity behind the measures of diet. And, a lot of those patients are solely on Ensure Boost shakes. And so their intake of fruit and vegetable is low, and that's being reflected in the Veggie Meter.
And I'll just add before, and then Alicia has her hand up, but that's the reason why we need multiple measures is so critical. Like not just even single measures within one time frame, but if you have the ability to do it over time, that's even better, because otherwise you just have a number and you don't really have enough data to know much about that person. And I think Alicia wants to.
Yeah, so that question of under 200, I have not ever found where the documentation came from either, but I did ask Werner Gellerman about it, who is the creator of the Veggie Meter. And his take on it is anything under 200, there's so much noise that it's going to be less accurate. So there's no documentation as far as I can find in the literature for that, but that's what he says. And that's challenging because my studies with kids, our average across thousands of people is about a 220. So huge percentages are below that 200.
Yeah, Kevin, I'm hoping you can speak to a little bit more about the last slide of the results that you shared, where you broke it down by like cutoff values, and kind of what one of the papers that came out a while ago said like 100 points on the Veggie Meter equates to one additional serving of fruits and vegetables. And again, anecdotally, based off of the data that we have, that is way too high of an increase to equate to one serving alone. And again, there wasn't the citation that went along with it didn't support that claim of that 100-point increase. And so based off of kind of what you've seen in your pretty large sample, could you speak a little bit more toward that finding and what you would recommend, and maybe some of the other researchers using the device right now can, even if it's a different dietary tool, we can kind of see what those changes in servings might look like?
Yeah, that's a great question. I think that's part of what might be next for us is so when we threw this idea out and kind of to the biostatisticians and asked for help in conceptualizing how do we approach the data we have and trying to formulate these cut points. It's interesting in the last slides of the results, the probabilities that they based the trying to find the scores based off of the veggie or the well diet. They use cut points of 11 out of 20, 14 out of 20, and 16 out of 20. And so I think we had a little bit of a miscommunication, right? And so if you think of it, 11 out of 20 from the well diet was really far off of meeting the fruit and vegetable intake. And so I don't know if we didn't have enough people who scored high enough on the fruit and vegetable subscale in order to begin to populate. If you look at what's like an 80% probability of getting a 16 or more, which would be one serving of fruit, one serving of vegetable, the Veggie Meter score is like in the high 400s. Yeah, and so I think that would be a score. It seems unrealistic that needs to be that high in order for the cutoff. Yeah, and so I don't know. I don't have much background in developing a clinical cut point, right? And so this was kind of our first stab at this. So I don't know if it was we didn't have enough data kind of at that end of the fruit and vegetable intake to make sense of what those Veggie Meter scores were.
Yeah, thanks for sharing that. I'm curious if anyone on the call was able to attend the International Carotenoid Society meeting, and if there was any Veggie Meter information there. So that's a meeting that is held every 3 years. I went to the one prior, and I think that was where, June, the paper you were talking about, maybe Carmen as well, where the device was actually used as an intervention tool. I know that there were some of those measures mentioned, like if you were below a 200, your risk of chronic disease was higher. I think there was some skepticism in the directionality of that relationship, or other factors. And then something like 400 and above was protective against, I think it was either specific to cardiovascular disease or chronic disease in general. So I know, Kevin, you had a really high percentage of your population that indicated one or more chronic diseases. And so, I think there's also questions about how things like higher levels of inflammation potentially influence scores, and how do we best measure that within a chronic disease state where those baseline levels of inflammation are probably already quite high. So the grip strength was a really interesting finding. I thought that there was no difference there. Yeah, now we can kind of, oh, go ahead, Kevin.
No, I was going to answer. I answered it in the chat too, but there was the question about how many devices we had, and so we just had one device. We're just really trying to get our money's worth here and just keep using that device. But no, I think there's a lot of what Carmen talked about too. I think was it's also helpful to think about the why we did what we did, right? And so like making sure that we had the wall behind us to try to hide those scores, right? Which is just good data practice too. But it was so interesting. I almost kicking ourselves for not asking the question, are you surprised at this score? I felt the majority of the participants were not surprised that their Veggie Meter score was, I felt that they felt it was important if it was beyond that halfway point, right? Like that almost seemed to mean something more to them. But no, I was just going to add just to answer the question in the chat.
Great, thanks. Any more questions direct to our presenters, or we can go ahead and open the floor for what we call our open discussion. So this is a time where if anyone else is using the device actively right now, has questions about what they're seeing, challenges that they want to talk through, now is our time to open that discussion. So would love to hear from the group if anyone has any questions to start. Or about, I think the dietary assessment tool is kind of always something that people have questions on. So I am familiar with the tool that you used, Kevin. I think it was either developed or validated here at Stanford. I know that there are challenges, especially in the community setting, about how to collect rigorous dietary data. I think with AI kind of on the verge of making an introduction here in the space, we use a tool called Diet ID, which is dietary patterns over the last 30 days. We've had some success validating it against NDSR dietary recalls, but it takes about 3 to 5 minutes. So very short, a quick one. It's mostly picture-based. So, lower language literacy levels across different languages. We've had success there. But I know with so many incredible dietitians and experts in nutrition on the call, would love to hear about what tools people are using and if there's kind of good comparisons with the Veggie Meter as well. Virginia, I think you have used the block FFQ. Is that correct with the kids? Not yet.
Not in our age group. I know it has been used with kids in the Veggie Meter. I feel like it was down in Texas. I think Stephanie might have been on that study. Do you remember that one, Rachel?
We used block, but it might have been when we were using RRS. Everything kind of jumbles together now.
Yeah.
We've also used EATS, which was the SNAP-Ed tool, at least here in California, that they used with moderate success.
Yeah.
But that's also older kids, not preschoolers. And Jody's group here in San Francisco used something in their Healthy Apple study, but that's as much information as I have.
Looks like Kim used 24-hour dietary recalls, assuming the NCI, the ASA, or was it another platform there?
NDSR.
NDSR. So
Mm-hmm.
gold standard, as they say, but very burdensome on both the research team and the participants. So I know that's been one of the critiques there is both cost and time there. So
Yeah, we have a study with Southeast Asian families with 6 to 11-year-old kids, and then we have them in another study with Latino kids that are 2 to 5 years old. And again, that's with 24-hour recalls, healthy eating index. And but we haven't looked at those studies. One study just ended. We haven't looked at the data yet. And the other study's still recruiting. So, but these are pretty small studies. They were kind of like pilot feasibility trials. So, I mean, we would love to talk to people about like compiling data. I don't know whether, our numbers are big enough to have anything meaningful, but if we could have a repository where we added our data in with other people's data, that, there may be some things we could do with it. So.
yeah,
That's been discussed for years, it feels like. And Kim, I know you work with preschoolers too, so at some point,
Yeah.
I'm happy to line up our measures as much as possible, especially if you have success actually getting people to complete them. That's our biggest barrier. I think Sarah has a question.
Hi.
Yeah,
Yes, Sarah Martinelli. I'm at ASU. Can you guys hear me?
yeah.
Okay. So I have somewhat of a technical question, just wanting to see if anybody's experienced this. So we're starting a study right now, collecting Veggie Meter data in grocery stores, in low income communities, in connection with the fresh fruit and vegetable program. The issue that we're having is we have a newer Veggie Meter, and we have an older one that was purchased by our college. So we're using two. Participants always being measured on the same one, just to clarify. But the newer one seems to occasionally require internet for us to open up the Veggie Meter program. And we, of course, have emailed the manufacturer because we were surprised by that. We've never needed internet to run the Veggie Meter. And, his response, of course, is like, nope, you don't need Wi-Fi, but that's not what we're experiencing. We can't get it to open unless we connect it to Wi-Fi. So I was just curious if anybody has run across that, or if that's some weird tech anomaly that we're experiencing.
We recently sent ours back for repair, and he specifically said, never connect this machine to Wi-Fi. You will have issues if you do.
That's so very interesting.
I
'Cause
didn't have a Wi-Fi issue, but I did have an issue where I couldn't open the icon, and it was actually because the computer had a virus. So because it's a
Interesting.
computer, it's not like Mac have really good antivirus protections on the computers, and it ended up being a virus, and I was able to clear it by I clicked on some antivirus software on the laptop, and it then opened.
Okay,
So I'm
that is
not
helpful. So we did run some updates on the computer just based on what our, university IT folks recommended. And it seems to be fixed now, but I think our worry is that seems to be fixed and then it's in the field with research assistants, and then the problem comes back again for some reason, and we don't know why. So I just wanted to see if anybody else was experiencing that.
Yeah. Anyone else on the call have had that experience? Terrifying when you're actively collecting data to just have the device not open.
Yeah, because if it was something else, right, we could just write down scores, but it's the fact that it won't take scores that's
the problem. So I know it shouldn't happen, but it definitely was happening for us. So we've just been a little so far it's still working, but we're just a little nervous, you know.
Yeah, I checked to see if there's any virus activity. Maybe that's the issue because it wouldn't, I would double click on the
Right, and it kind
software
of would
to
just like
go in circles. That's
yeah.
exactly the issue I had. So it wasn't a Wi-Fi issue for me, but I don't know. Hopefully it's the same issue.
Yeah, I mean that makes me feel a little better because it sounds like, you know, we ran the updates on the laptop and then it seemed to work. So it might have just been really the laptop itself, not the Veggie Meter, you know. So, you know, it's not terribly difficult to keep the laptop up to date. So that's, but, you know, again, in the middle of a data collection session, that might be a challenge. But okay,
I have a
that's
comment.
helpful. And go ahead.
Hi, I just I apologize. I'm looking for and I can't find the raising my hand icon for some reason today. Just a quick one. The idea of a database is, you know, probably a very good one. My concerns are the different ways data are collected, not so much from the Veggie Meter, but from the dietary assessments. So, you know, different people have listed what they're using. We have used the ASA 24. You know, none of these are terribly helpful if they're 24 hours unless they're repeated, ideally at least 3 times. With Veggie Meters, we have a project that'll be presented at Nutrition and working up the manuscript, where in that instance it's on lactating women and breast milk composition with this. But you know, I think there would need to be some consensus or lack of consensus, some meaningful, I'm not sure that's really possible, meaningful transformations done on the different dietary recalls that people use. Maybe everybody, you know, could come together and decide on, you know, a common heuristic to use, but
Yeah, definitely agreed. And especially as the dietary recommendations are changing, is it servings? Is it cup equivalents? Is it, you know, like exactly what we should be reporting on? I think there's a lot of challenges there. I think part of the repository would have a column where people can list what that is, and so the generalizability and comparisons can be across similar populations that use similar tools. So I think that's one way. I think we've kind of shared in the past what we envision for this repository. And I think, you know, as the forum is gaining momentum, it seems like each time we have more people conducting research across more populations, it may be something that we want to prioritize is, you know, some sort of algorithmic based web app that can be integrated into our website, which we'll give the last 10 minutes for, where people can put in height, weight. We know BMI is negatively associated with Veggie Meter scores.
I really think this sort of thing would benefit from having a bit of an action committee or at least study group to figure out a common data set. And you know, the issue I'm bringing up about different dietary recalls is a little bit less if one does transformations like logging in an HEI or even a DII or other things, regardless of what data source one's using. You know, you could use a lot of different ways of getting there.
Yeah, no, it's a great idea. We can definitely follow up and see if there's an interest of anyone on this call to kind of join a working group, and we can start between now and our winter forum. We have some time, and summer, I know for some people is a little bit lighter of a load with teaching maybe drifting off. So that is definitely a call. We have now a website. So I think now would be a good time to turn it over to Virginia to share kind of the very early developments of our website. We would love to have photo headshot bios from everyone who's interested in serving working kind of collectively as the collaborative, so we can have a contact page with all of the researchers here today, and for those not able to attend, would still love to have added to that. And that's a place where we'll host publications. So any new Veggie Meter related publications will be housed there. So as people are writing up their manuscripts, it's kind of a one-stop shop for publications, as well as the protocols. We will add Carmen's Adaptations for the Community Setting PDF to that as well. So everyone has access to that if they're working in the community setting. But turn it over to Virginia to share the website, or very early designs, but
Not, I mean, the bones are there. So I think this is the phase where we really hear from you in terms of the direction we go and what is added. I think at a minimum, everyone, and we can put the link to that survey, but you actually can also find it online pretty easily now. So you can go to this web address, which we can put in the chat as well. And then I will send it out in the email along with the recording for this, so you don't have to remember. But so far, we have just generic information. You can find the recordings from past as well as current. On the front, it'll link you to the YouTube page. You can send anyone here to get added really to the listserv, which still is just emailing me. I feel like that's easier than having people fill out a form that I have to go check. Just send me an email. But pretty much everything's there. So what we need from you kind of in the immediate is if you want your papers here, we are actually listing all the papers that people want to post up here. It is a searchable database by author and any other keyword that we can add. If you want specific words attached to it, you can let me know. This will link out to the PubMed or whatever other source where the paper is available for people to download. And then also, if you personally want to be posted up there as someone who might be interested in collaborations or just having your research, who you are and the work you're doing in this space, you also might trying to get it to click on the profile piece. Oh, sending me in the wrong place. Okay, well, at one point, I think I've duplicated accidentally something in the researcher profile. I'll fix this in the next couple of minutes. But there are researcher profiles up there. As you'll see, there's only a handful right now from the people that we just reached out to just get some things set up. But you can basically have your name and information posted there. I'll fix this in 2 seconds here in a second, and then you can kind of see what that would look like. But if you want your name up there, for contact purposes, to have some of your featured articles, just so that it facilitates networking and things like this. If you're interested in an area of collaboration, that could be a neat thing to put there too. And we get contacted all the time about who's doing what work or where can I find these papers. And so the idea is that we would then be able to really put that information all up here. And so if your work is there, then people are going to see it being posted there, and you as one of the people doing work in this space, in whatever space it is that you want people to see that. I'm going to pause, unshare, fix the profile, and then I'll come back. But any questions about this space or what we can do with it? I know I've taken some notes today about some things. There is a space there with about, and it talks about the Veggie Meter and some of the things we generically recommend. Lots of notes from Carmen's. She gave us permission to post her handout up there. And I think we could probably, I asked her if we could feature her paper on the front page. So when we announce it, that some of those neat recommendations are there along with the paper. And so as we have new forums, we'll be able to have those papers featured. In fact, I think it's automatically highlighting the papers that were featured on a forum in the publication section. I'll have to figure out how to link it to that forum maybe. Sorry, getting ideas as I'm talking, but anything you might have idea-wise, like throw it at me. We'll see what we can integrate. And I think it's just a great place to start storing some of these things so that we just have a place to go instead of just emailing, where's this or who does this or do we know what this is about? So anyways, I'll stop talking, fix the profile, ask questions.
Yeah. One of the areas, Virginia, that showed on the website, but you didn't mention, is kind of a grantsmanship tab. And so as we know that Stephanie has gotten some NIH funding for work with the Veggie Meter. We have a couple pending grants, hopefully will be received soon. And so we're all happy to share the methodology from those grants. And so we can start to have a really consistent language that's being used. So as our grants are being reviewed, whether at the USDA, the NIH, whatever granting mechanism platform you decide to submit to, that language is consistent and we can kind of build a little bit more strength behind our grants so that as people are reading them, they're not questioning the validity of the tool. And just to add kind of behind the scenes, some of us here are working on a meta-analysis right now to look at the Veggie Meter as it relates to carotenoids in the blood. And we hope that that can strengthen some of the physiological aspect, mechanistic aspect of the device as well. So to come, but that is in the works right now to, again, strengthen our grantsmanship as a lot of us are putting in more grants with the device. Alicia, go ahead.
I've recently been starting to put some of my code up on GitHub. Would anybody be interested in sharing things like that as well for analyses?
Absolutely. I think one of the questions that has come up time and time again too is like what to include as covariates in our models. I think that could be super helpful where we have maybe like a statistical analysis section of this website and people can share code that they've worked on and what covariates they've included and all of that I think would be awesome. Virginia, another thing to add to the list.
It's on there already. I just haven't like filled out all the detail because some of these sections will take a little bit more careful analysis. I was very hesitant to put things up there that we don't really have solid things about. I want to make sure that when we put it up there, we're clear about this is published, this is a practice we do, but take with precaution or ask this person. So these are the places, Alicia, I think will be super helpful to hear from you guys so that we can fill it in and then add the right context so people know sort of at what level this particular practice or thing is done. I fixed the researcher profile page. Sorry about that. But the analysis piece, so if you go to the protocol best practices section, this is where some of that actually gets built out in different sub tabs. Forgive all the tabs, but once you get to the main page, it doesn't move off the pages. It is just one long scan. So you can see the analysis is like a coming space and how to diagrammanship those things. So we can make it a new tab if it becomes so robust that it needs its own space. But these are the spaces that we want to add, but we want to do it with very careful purpose so that we don't send people off in another direction that's like not helpful, and so that we get the right approval. So if it's something like Alicia, yours, right? Like we wouldn't want to share things that you haven't explicitly said, yes, that's okay, that this can be publicly shared. So yeah, I'm excited. So hopefully this is meeting people's needs or getting there. Yeah, and by the way, if anyone needs to build a website, Claude does a great job.
Yeah, so again, this is, early phases of website development. So after the forum, if you think of anything that you think would be really beneficial to have added, in addition to profiles, please feel free to reach out and Virginia, Rachel, and I can work on integrating that in. And our goal is that this becomes a really useful platform to generate collaboration, answer a lot of existing questions. I think, over the last 9 forums, we've had some continuity in some of the challenges that a lot of us are facing with the device. And so we think this will be a good place to house some of those. So as people, run into some of these, I think an FAQ page Carmen mentioned for like an FAQ for community troubleshooting or FAQ for children troubleshooting. I think this is definitely a space where we can build out those. And so they're easily accessible as data collection is ongoing for many of your studies. In the last 5 minutes, want to turn it over for any last pressing questions from our audience. A huge thank you to Kevin, June, and Carmen for all of the presentations today. Really fantastic job, and it's always exciting to see the space and the field advance. So thank you for all of the work that all of you are working on. If no further questions, feel free to hop off. Enjoy the rest of your Thursday, everyone. And thank you all for coming. We appreciate all of the collaboration and more information to come on the website, on the repository. And if anyone has any ongoing work or work that will be ready to share come winter, please feel free to reach out to us. We love to have people reach out to us. But if not, if we see papers come out, we will likely be reaching out to you to see if you would be interested in presenting at our next forum.
We
If you
usually
see
send out a
good
survey.
paper,
Yeah.
yeah, but yeah, I think it's in the, I can put it in the follow-up email with the recording. I probably, just a heads up, I probably won't share the website link. So go ahead and grab that right now. We'll share that probably in a couple weeks. I want to get Carmen's stuff and whatnot posted. But you'll see that in a follow-up. I'm going to try to get the recording up today so that that can go ahead and get out. But if you see papers too, even if it's not yours, send those, because that always gives us good ideas for speakers. That's how we found Carmen, actually. So, thank you, everybody.
Awesome. Thanks, everyone.
Thank you.
Appreciate all your time.
Great,
Thank
great
you.
workshop. Thanks.
Bye.
Thank you, Kevin. That was
Thank-
great.
Thank you for the opportunity. Appreciate it. It's fun to
Yeah.
talk it out loud and just, yeah, start the conversation, as June was saying, just to hear if the clinical cut point, I have no clue how to actually make that, right? Like from a statistics standpoint, but I don't know.
Yeah,
But I
and a lot
love that
of
you're like going down that road. I love it.
we
Yeah.
need it. We absolutely need
Mhm.
it. And I think a lot of the like more controlled feeding trials have just been associated with like kind of general intake. I forget what conference I was at, but someone did like a carrot feeding study and they gave people the same number of carrots over time. I forget, it must have been ASN maybe 2 years ago, but I never saw the publication come out of it. So I don't know. I don't know what happened with that one, but yeah, I think there needs to be maybe more of these like controlled feeding trials where we do number of servings over time. So if that is of interest, I know that that would be very beneficial to the field. Of course, all it takes is funding, but
Sure.
yeah.
But yeah, thanks so much. The website looks great too, by the way.
Yeah.
Nice job.
Keep us posted on when your publications come out. We'd love to share them.
Fingers crossed.
Yeah. And send me your stuff. I can put your little bio up there.
Okay. Sounds good.
Yeah.
Thanks so much. Take
Awesome.
care.
Thanks, Kevin.
Any questions from those remaining on the call? We're happy to stay on and take them.
I'm going to go ahead and stop the recording.